Ever pondered upon the question, what if the very thing that promises to protect us holds a secret that might just shake the world? In the grand theater of human health, few things have sparked as much debate and division as vaccines. They are hailed as the guardians of public health, the invisible shield that keeps disease at bay. Yet, in the same breath, they are painted as the clandestine instruments of some grand conspiracy, a Pandora's box of secrets and lies. Two narratives, both compelling, both steeped in passion and conviction. The question is, where does the truth lie? Is this life-saving, preventative, the hero of our tale, or is it the unseen villain lurking in the shadows? This, my friends, is the enigma we aim to unravel. This is the journey we embark on, sifting through the facts, debunking the myths, and discovering the truth. Today we delve into this mystery, unearthing facts and myths about vaccines. Let our journey begin. The story of vaccines takes us back in time, a tale of triumph over dreadful diseases. It's a journey that begins in the late 18th century when a brilliant mind named Edward Jenner made a curious observation. He noticed that milkmaids who had suffered from cowpox, a disease similar to smallpox but far less deadly, seemed to be immune to the devastating smallpox epidemics that regularly swept through Europe. From this observation sprang the world's first vaccine, a tool to arm the human body against the onslaught of smallpox. As the centuries rolled on, the power of vaccines was harnessed to battle other foes. In the 1950s, Jonas Salk and Albert Sabin developed vaccines against polio, a paralyzing disease that once struck fear into the hearts of parents worldwide. By the 1970s, smallpox was eradicated, a feat achieved through a massive, coordinated global vaccination effort. Then, in the closing years of the 20th century, vaccines against hepatitis B and Haemophilus influenzae type B began to reduce the incidence of these diseases, which can cause devastating illness in children. And in the early years of the 21st century, vaccines against human papillomavirus and rotavirus were introduced, offering protection against cervical cancer and severe diarrheal disease. Fast forward to our present day, where vaccines are at the forefront of public consciousness. The COVID-19 pandemic has seen the development and deployment of vaccines at an unprecedented speed thanks to advances in technology and a global commitment to ending this pandemic. Throughout this journey, vaccines have proven time and again their ability to control, and in some cases, eradicate diseases that once wreaked havoc on humanity. They have saved countless lives and prevented immeasurable suffering. Scientific evidence overwhelmingly supports their effectiveness and safety. Indeed, vaccines have played a pivotal role in our survival, but the plot thickens as whispers of conspiracy weave through this narrative. Conspiracy theories, like a shadow, have trailed the path of vaccines, casting doubt and fear. In the labyrinth of the global discourse, certain narratives regarding vaccines have burrowed deep. Let's shine a light on them. Some argue that vaccines are part of an elaborate scheme, a tool wielded by those in power to control the masses. They point to the rapid development and deployment of vaccines and whisper of hidden agendas. Others raise concerns about the ingredients that make up these vaccines. They talk of harmful substances, veiled behind complex scientific names, slipped into the vaccine recipe to cause harm instead of healing. They recount tales of people developing conditions post-vaccination, drawing a direct line between the two events. Then, there are those who fear the health risks associated with vaccines. They speak of the potential for adverse reactions, long-term complications, and the unknown. The anecdotes are chilling. Stories of healthy individuals suddenly plagued with health issues, families torn apart, lives that will never be the same again. These tales, woven with threads of fear and uncertainty, have a powerful allure. They tap into our instinct to protect ourselves and our loved ones. They question the very foundation of our trust in medical science. But let's not forget, every coin has two sides. While these theories paint a dark picture, they are often born out of misinformation, misinterpretation, or simply a lack of understanding. They thrive in the absence of clarity and feed on our innate fear of the unknown. It's important to remember that correlation does not imply causation. Just because two events occur together does not mean one caused the other. It is equally essential to understand that the ingredients in vaccines are there for specific reasons: to stimulate our immune system, to preserve the vaccine, to enhance its effectiveness. These theories, however enticing, demand rigorous scrutiny. And so we turn to science. Science, the beacon of truth, guides us through the murky waters of misinformation. In our journey to understand vaccines, it's essential to debunk the myths that cloud our vision. Let's start with how vaccines work. They're not some nefarious plot to control minds or alter DNA. Rather, they're a tool, a shield, if you will, designed to train our immune system to fight off harmful pathogens. They do this by introducing a harmless piece of the virus or bacteria into our body, just enough to spark our immune response, but not enough to cause the disease. Next, let's talk about what's in a vaccine. Some conspiracy theories suggest they contain harmful substances, even microchips. The truth is far more mundane. Vaccines contain tiny amounts of the virus or bacteria they're designed to protect against, along with other ingredients to keep the vaccine safe and effective. These may include preservatives to prevent contamination, adjuvants to boost the immune response, and stabilizers to ensure the vaccine remains potent during transportation and storage. No microchips, no alien DNA, just science. Now on to safety. Vaccines are among the most rigorously tested medical interventions on the planet. They undergo extensive trials involving tens of thousands of participants before they're approved for use. And even after approval, they're continually monitored for safety and effectiveness. But what about side effects? Yes, vaccines can have side effects just like any other medication. Most are mild, like a sore arm or a mild fever. Serious side effects are rare and usually occur within a few days of vaccination, making them easy to track and study. And finally, the long-term health risks. Multiple studies spanning decades have found no evidence that vaccines cause chronic health conditions. Instead, they prevent them, protecting us from diseases that can have severe long-term consequences. As we see, science shines a light on truth, yet the debate continues, fueled by fear and skepticism. In the end, the choice lies with us, a decision that should be informed, not influenced. In our quest for understanding, we've journeyed through the annals of history, delved into the world of conspiracy theories, and debunked some prevalent myths. Now we find ourselves at the crux of the matter, the importance of informed choice. Our decisions, especially those pertaining to our health, should be rooted in knowledge, in facts. In the age of the internet, information is at our fingertips, but not all that glitters is gold. It's easy to get lost in the sea of opinions, to be swayed by convincing-sounding arguments that lack a scientific basis. Here's where the importance of discerning reliable information comes to the fore. Consider this, my friends. Vaccination is not merely an individual choice, but a collective one. When we choose to vaccinate, we're not only protecting ourselves, but also those around us. Our decisions ripple out, affecting our communities, our societies. And so it becomes imperative that these choices are informed based on credible scientific evidence. We acknowledge the right to question, the need for transparency in public health. It's essential to foster a dialogue, to discuss our concerns openly. That's how we learn, grow, and make progress. So, if you find yourself in the throes of doubt, reach out to healthcare professionals. They are the torchbearers in this labyrinth of information, guiding us towards the light of truth. Healthcare is not a realm of absolutes. It's a complex, ever-evolving field. New discoveries are made every day, theories are revised, practices are updated. But one thing remains constant: the pursuit of well-being. And in this pursuit, an informed choice is our most potent tool. So as we conclude our journey today, remember that knowledge is power. And an informed choice is not just a choice, it's a statement. It's a testament to our ability to discern fact from fiction, to make decisions that safeguard our health and the health of those around us. As we conclude our journey, remember, an informed choice is a powerful choice. So, vaccines, prevention or conspiracy? The answer is not simple, but the quest for truth is worth the journey. We've delved into the annals of history, unearthed some of the most prevalent conspiracy theories, debunked myths, and emphasized the importance of making informed choices. Yet the journey doesn't end here. The world of vaccines is vast and constantly evolving, a labyrinth of knowledge waiting to be explored. It's a journey that requires courage, curiosity, and a critical eye. Remember, in this quest for truth, your greatest weapon is knowledge. It's your shield against misinformation, your compass for navigating the maze of half-truths and outright lies. It's the tool that empowers you to make informed decisions about your health, your well-being, and the well-being of those around you. So, venture forth into the world of knowledge. Keep questioning, keep exploring, for knowledge is the antidote to fear.